if you count 100 women, only 30% of women, they get regular orgasm on penile vaginal intercourse. Some women feel orgasm on regular basis. But there is a myth that if I don't get orgasm, that means my partner is not competent, which is very wrong.
And how do we deal with it in our own lives where most women don't even know if they had an orgasm?
Okay, so let me start like this. So many male partners, according to me, once they finish penile vaginal intercourse, they just go to sleep or they just lie down on the bed.
That's another problem.
That is another major problem.
Do you think that when people come together for marriage, it is important to have sexual compatibility and you should check that before marriage? Like, would you recommend that?
I don't know how can you judge somebody sexually competent or not by having sex 2 or 3 times. In fact, it can cause more problem, according to me. The reason is,
most young girls face a problem where they feel a lot of pain during sex, and how to overcome that?
sometimes there are biopsychosocial issues.
And so what are the food items that you would recommend, to increase one's sex drive?
To have a happy and healthy sex life, you should be
Welcome to Women's Social Corner. I'm Janvi and this is WSC Picks. We are in the era of misinformation and what we need the most is proper sex education. Today we will deep dive in the topic of sex, and to discuss this we have consultant sexologist Dr Ashok Rughani with us. So let's get the conversation going. Welcome to Women's Social Corner. And so to start with, as we have so many of women audience, we would want to know that how is women's sexuality different from men's sexuality?
Hi, good evening. So women's sexuality is definitely different from male sexuality because that is how the nature has created women. Yeah. Women have a different kind of hormones. Women think also different way. Women are emotionally different than male. To go a little bit more in specific, male would prefer more physical things in sex life. Women, they need some time, they want more emotional attachment, they want more caring and loving man, they want somebody who can understand her, who respect her, who give her good space in her life. At the same time, he is honest. Now, it doesn't mean that male are not honest, but it's different way of looking at the people's life. So most of the women, they would prefer partner to be more honest, more emotionally attached, more open and taking care and loving, things like that. And male wants more physical things, unfortunately or fortunately. It is more related also with hormone. It is more also related with education background. Things have been changing with our, now if we talk about India, because if you see last 20 to 30 years, women are more educated, they are more independent, so their demand is also different now compared to my mother and grandmother and your mother and grandmother. True. So women also change, society is changing. Education, they are more independent, they get enough money to survive.
And that's
why things have been changing. So it's a multifactorial things. Yeah. So it's more of a biopsychosocial things.
True. So when it comes to women's sexuality, one of the things that is a concern is women orgasm. And how do we deal with it in our own lives where most women don't even know if they had an orgasm?
Okay, so let me start like this. Where if you count 100 women, about only 30% of women, they get regular orgasm on penile vaginal intercourse. Yeah. So that is why foreplay, play and afterplay is very important. So foreplay means women are not ready physically unless you prepare her, unless you stimulate her. Mental stimulation and physical stimulation. So mental stimulation means you talk with her, you hold her hand, you talk nice sweet things, you touch her, you kiss her, you kiss. You see, everybody have different love spots. Some women like kiss on the lips. Some women like kiss on the, earbuds, or some women like kiss on the necks, which is very common. Some women prefer breast stimulation or breast sucking or breast bite and things like that. Now, God has given a very specific part in female. It's called clitoris. Now, I think most of the women, they know what is clitoris, but I can show you on this figure. This is the part, very small skin on top of the vagina, that is called clitoris. Now, small part of clitoris contains 8,000 nerve endings, 8,000. Now, you can imagine when we touch on our finger, there might be few nerve endings. Yeah. Then also immediately you get the message. So when you are rubbing or touching 8,000 nerve endings, you get real stimulation. So clitoral stimulation is very important in foreplay activity. At the same time, lips of the, we call it in medical language labia majora and labia minora, but we can call in general terms lips. It's also sensational. Some women also like perineal touch and even anal massage and anal touch.
Sure. These are the...
Yeah, these are all, we call it, love spots. Sure. Now, some women prefer even fingering. Now, there are some research, they believe that there is a spot inside the vagina. It's called G-spot, Grafenberg spots. He was a German gynecologist, Grafenberg, and he gave the name a spot called G-spot. Now, there is a controversy about it, but let's say if it is G-spot, some women, by doing fingering, they feel good. Whatever way they feel good is good.
Yeah,
so basically, to do good foreplay includes physical touch, emotional touch, loving and caring, and all the sweet things. That way you can make her arouse. Sure. See, there are 4 steps in sexuality. One is desire, second is arousal, then orgasm, and then resolution. So in male, desire, arousal means erection in male, but in female they get a lot of blood circulation around the vagina and even on the body, parts of the body. So they get good lubrication. When you are aroused, you get good lubrication. And lubrication is a very important part in female. 2 reasons. One, female will not feel pain with the lubrication. And the male partner also easy to penetrate. So it's a natural thing. Now sometimes women have less lubrication, then we advise to use, easiest way to use is saliva. Yeah. Male saliva or female saliva, which is fine. If it is the partner, trustworthy partner. Otherwise, use lubricant, which is very much available in the market. So many lubricants, KY jelly and estroglide, and so many lubricants available in the market. It is okay to use water-soluble lubricant rather than oil. Okay. Now, it's up to individual person, but this is what we recommend.
In the popular culture, like people just recommend.
Yeah, right. Yeah. So, now, talking about orgasm. Orgasm is also related with mind and body. So if you are healthy and if you are open-minded, some women feel orgasm on regular basis. But there is a myth that if I don't get orgasm, that means my partner is not competent, which is very wrong. So I want to clarify, and I would request all the women to support male partner, that if you don't get orgasm, don't blame your partner. Okay, there might be some problems with partner which he's not giving you good foreplay activity or some other reasons which I'm coming to immediately. But one of the thing is that don't keep that fixed things in the mind that if I don't get orgasm, something is wrong with me. No. So 30% women on regular basis, they get orgasm, penile vaginal intercourse. 60 to 70% clitoral stimulation along with vaginal stimulation. Okay. So if a male partner knows how to satisfy a female partner, he should give clitoral touch with the finger, make sure your nails are cut, or if you trust each other, you can use your tongue. Slowly and surely, women will get orgasmic feelings. You can give and rub and ask her if she's feeling good, you can give her more massage. At the same time, you can do fingering, that also helps. So fingering, clitoral stimulation, emotional things, everything includes in foreplay. So ideally, this is what I feel, that if you give one orgasmic feelings to your partner during foreplay, so that during play activity, play means penile vaginal intercourse, she is comfortable, she has already got orgasm, but the God is great. So God has given women a gift of multiple orgasm.
Okay.
So women can get more than one orgasm also, which is great. So during foreplay, she can get one orgasm. She might, if she is lucky, she might get orgasm during penile vaginal intercourse.
Yeah, so
it's win-win situation, and win-win situation for both. Now, we call it foreplay, play, and afterplay. Now, if sometimes, so many male partner, according to me, once they finish penile vaginal intercourse, they just go to sleep, or they just lie down on the bed.
that's another problem.
That is another major problem. So I request all my male friends to don't just go to sleep. Stimulate your partner by sweet talks. She wants you to talk with her. Ask her how was it, whether she enjoyed it or not. Or she wants more stimulation, you can give oral stimulation on clitoral or fingering, kissing, hugging, touching. All these are very important. Just a simple hug can also, so many women get orgasm. Or sometimes by sucking breast also some women get orgasm. Or some women get orgasm even by kissing. Or I've heard that some women get even orgasm by just having emotional love.
And so this topic of orgasm brings me to female masturbation and use of sex toys. I mean, what are your thoughts on that?
Okay, so female masturbation, according to me, the way male do masturbation, why should female not do masturbation? You are alone, or you, even if it's your partner, you can do mutual masturbation. That is great. If you are alone and if you have a sexual desire, better you do masturbation rather than having stress and tension and worry. I think many women, when they don't get sexual satisfaction, they get angry. They don't know the reason why they are angry.
So much piled up.
Yeah. But they are angry because they are tense and they haven't got orgasm since long. By doing masturbation in your privacy, manually, or by using sex toys, it is perfectly normal. When you are using sex toys, there are multiple sex toys available in the market. Legally or illegally, I don't know. But it is available.
They are perfectly healthy for people to use.
So when you use sex toys, you should keep the hygiene and use your sex toys for yourself only. Don't share it with your female friends or your male partner. Then it is perfectly okay. So sex toys are not bad. It is not harming anybody. You do whatever you want to do. If you are not harming third party, why should you worry?
True.
But for your satisfaction, masturbation is normal and healthy, provided you do yourself and you enjoy. You can use sometimes lubricant during masturbation, which is very okay.
And so what about people having multiple partners? Do you think that it's healthy if one should go with it or one should not?
Well, I'm nobody to say this is not good and this is good. But I'll give my opinion as a doctor, not personal opinion. So this is my opinion as a doctor, not as an individual. It's very much depends upon individual. If you want 4 boyfriends, it is you to decide. Why some society should decide how many boyfriends you want?
Yeah.
Okay, once you are married, I think monogamy is important part to have a happy and healthy marriage life, which is, there is no doubt. Now there are some couple these days and even in the past, they have open marriage. Or they have, there are so many words they use different way. But basically, if both partner agrees that, okay, I will have a friendship with another man and I will have a friendship with another female, or swapping couple, which is very common since many, many, many years. I think if you go in the olden history, even 500 years ago, it was common. So I don't say it was bad or good, that is individual choice. So basically, it is individual choice. The point is, you should have open communication with your partner, that is number one. And you should always use contraceptives like condom, or mainly condom to avoid infection. You can't just trust somebody by just looking at somebody. There are so many infections like HIV, herpes is very common, genital herpes, syphilis, gonorrhea, chlamydia, and many more. Even human papillomavirus, genital warts, very common. So these are very common infections I see in day-to-day in my practice, and I've been seeing since 1981, this kind of infection. So I would advise everybody to use condom. Just don't trust somebody on blind trust. Yeah, if you have a long-term relationship, you can have sexual relationship without condom. That is fine. Rather than having getting infection, better to go to the laboratory and test your blood.
And so most young girls face a problem which is vaginismus, if I'm pronouncing it right, where they feel a lot of pain during sex, and how to overcome that.
Okay, so the terminology is like this. There are so many couples and young girls have a problem of painful vaginal intercourse. Yeah. In medical language we call it dyspareunia. So there, first of all, a good gynecologist or a sexologist should examine female to rule out that she doesn't have some ulcer or some scar or some kind of infection inside the vagina, vaginitis or something, so that sometimes they feel pain because of the infection. Then you can treat her and then she'll be fine. Now, sometimes there are biopsychosocial issues. Biological issue means any physical illness. Psychological issue means I get many patients with unconsummated marriage life. In India, we don't have exact figure, but in USA, unconsummated marriage life is 6%. So probably in India, it's 8 to 10%. Now, in the unconsummated marriage life could be because of the male factor or female factor. Now, we are talking at this time about female factor. It could be because she has heard so many stories about sex is very painful. Yeah. It's going to cause you a lot of bleeding.
A lot of traumatized already.
Sometimes child abuse. This is also a big problem. You've been abused by your relatives or friends or unknown person when you were young. You have never talked to somebody. Back of the mind, there's a fear. I have seen and treated many patients like that. Child abuse is very common. And mostly child abuse is from the relatives or friends or neighbors or somebody. Yeah. Unfortunately. So it is very important that give her a full confidence and let her speak out or get good history from the female partner. If it is a psychological issue, you can treat or you can consult or you can take advice of a psychologist or psychiatrist also. So that is one part of the painful vaginal intercourse. The other one is medical issue, vaginal infection or something like that. Vaginismus means involuntary spasm of the 1/3 of the lower part of the vagina. Okay. So women have unknown reason or sometimes because of the childhood trauma, they have a fear, so they make the vaginal muscles very tight. They tighten the pelvic floor muscles also, so that as soon as the male partner or a boyfriend or a husband tries to go near her, she is frigid. She doesn't want to open the legs, or she will cry, or she will, shout. And that way male will also lose the erection. Yeah. By doing this on day-to-day life, then they avoid sexual intercourse. Because then he is tired and he is disappointed. And female is also disappointed and she doesn't know where to go.
And they don't know what the problem is.
They don't know the problem. So best thing, advice is go and see a doctor, talk with her or him openly. Better consult a doctor who has some experience in this field. Not necessarily, you can go to gynecologist or a sexologist according to your choice. And you can definitely get a treatment. There are so many treatments available for vaginismus. In USA, when I was in USA, I treated one female. She visited 6 gynecologists and then she came to see me. And by doing some simple treatment, she became okay and now she's mother of 2 kids. She's still in touch with me since last 15 years. So there are many patients I have treated here. And I have one couple who is even ready to come on and face the general public. They had a problem of, unconsummated marriage life for 12 years. They went for 3 times IVF, 4 times IUI. Fortunately, at the age of 39, she is conceived. And now she has a boy of about 11 years old. And she is ready even to give her interview.
So many.
There are many patients like that. So do not afraid to seek help of a professional person. Yeah, but this is how it works.
True. So what about couples who lose out on the interest of having sex, after a certain years of marriage? What's your advice to them?
So this is like this. If you eat every day chapati and vegetables, then you want some change. Now, I'm just giving you on lighter modes, but in reality what happens, there are a couple of things happens. One is, sexual problems all are related with bio-psycho-social issue. So what is biological issue? Sometimes male partner is having problem of erection, or most of the problem in India is unfortunately premature ejaculation. We call in Hindi shigrapatan, which is one of the most common sexual problem happens in India. So that male partner ejaculates very fast, so female partner doesn't get satisfaction. Now in the beginning of marriage life, she doesn't know, so she will not speak out. But after some time, she will know from friends, or she might have read somewhere in the newspaper that,
that's why
I'm not getting satisfaction because my husband is coming out very fast. So that is called premature ejaculation. So she is not getting sexual satisfaction, or she is not getting orgasmic feelings because the partner is ejaculating very fast. So one of the reasons of not getting orgasm is premature ejaculation.
This is also very common.
Very common means unbelievable common. Between the age of 20 to 40, I would say very common. I say most of the patients, 60 to 70% young generation, unfortunately, they come here because of premature ejaculation.
Yeah.
Second thing, male partners should know how to treat their wife. Give her take care of her birthday, take care of marriage anniversary, give her flowers, give her a nice night dress, romantic and sexy underwears. So that you make this, माहौल बनाना चाहिए आपको. आप माहौल नहीं बनाएगा तो कैसे गाड़ी चलेगी? Number one. Number two, I'm coming to the female part. Female also, they get tired while working from morning till evening. Second biggest problem in our country, and I've been to so many countries in the world, I have practiced for many years in Kenya and USA. Children, they sleep with family, with parents. This is really a major issue, according to me. I understand we love our children. If somebody is having problem of bedroom, they don't have a second bedroom, that is fine. But sometimes, so many patients have to, I have a bungalow of 5 rooms, but we sleep together. But you sleep together and you don't have sex life, my friend, because you don't have privacy. And you have children of 16 years old girl, you have a 12 years old boy. How can you have sex? It is bad even, because the girl knows even she is getting menstrual cycle, and the boy is also doing masturbation, and he's watching you. How can you have sex? So one of the reason female partner is not comfortable, so she is avoiding and suppressing her sexual desire by not having sex. Number one. Number two, it is the problem with some women, they get tired, so hygiene is also a problem. Some men might not like that unhygienic condition. Female partner, to be very frank, do not feel bad. I'm just telling you for your benefit. You should take shower in the evening. You should have a nice night dress. Sometimes you change your clothes and have a little sexy look. And let your partner also feel good. So it is your side also. You need to take some initiative to enjoy marriage life and sex life. You just can't say, oh, I'm tired. If you are not feeling well, go and see a doctor. Sometimes anemia, sometimes deficiency of B12 or vitamin D. Sometimes hypothyroidism is also very common in females. So these are common cause, biological cause, social cause. I explained about the privacy issue. And psychological stress, trauma. You are not happy because of the family issues or personal issue. You have some doubts. Now, last point I would like to mention is mobile and TV. This reality show, you keep on watching, they brainwash you. You are on Facebook and Instagram and WhatsApp universities and all this nonsense. So I would advise everybody, stop your mobile after 8 or 9 p.m. And if you stop, your husband will also stop, and you should have an open communication with partner. Sometimes I have seen some family, they are sitting, husband, wife, children, all are communicating to each other on mobile. Come on. Yeah. This is not good, my friend. This doesn't happen in other countries. We are just really after mobile. We are just made for mobile. It is better to be made for your husband rather than for mobile. So, okay, so that is what it is.
These are the causes. And so what are the food items that you would recommend, to increase one's sex drive?
To have a happy and healthy sex life, you should be physically healthy, you should be mentally healthy, and you should have a happy relationship with your partner. Eat dry fruits like almond, walnuts, so you get better cholesterol. Eat a lot of vegetables and fruits will help you not to put on a lot of weight, because after one child or second child, most of the women, they put on weight. The reason is they don't take care of their health. I mean, you need to take care of diet and exercise. You should do exercise. If you do exercise, your testosterone level will go up. Testosterone is also important in female to have a sexual desire. So normally, I would advise female to have a happy and healthy diet. Think positive. Sex positive is also very important. Some women after certain age, now we are old. Old what? 40 years, you are not old, my friend. She said, now I'm in menopause. Now I have children who are married, so I don't need sex. That is not good. There is no expiry date of sex. Please write down in your diary. So you tell your partner also that we are still young. Never think about age. I'm 68 years old only. And I have everything happy. So it's not like age, it's just the way you think. So my friend, don't worry, just enjoy life, eat healthy food, think positive, go for exercise, go for gym, go for morning walk, evening walk, take care of your hygiene and enjoy your libido.
And sir, do you think that when people come together for marriage, it is important to have sexual compatibility and you should check that before marriage? Like, would you recommend that?
Well, that is a very controversial question. I don't know how can you judge somebody sexually competent or not by having sex 2 or 3 times. In fact, it can cause more problem, according to me. The reason is, see, when you are, let's just talk about male. So when you are seeing a girlfriend or a female partner first time, you are under a lot of anxiety, stress. Sexual performance anxiety is a leading cause of sexual problems. Sexual performance anxiety. Now, when you are meeting somebody, you are going to have a sexual performance anxiety. Sometimes you are ejaculating before even you start process. So that doesn't mean that you label him as not competent. I think experience makes man perfect and practice makes man perfect. Now, who will be ready to have a practice for 6 months or 1 year?
Before marriage.
So that is my opinion.
Yeah.
But yeah, you are right. If we are suspecting, it is better to seek a help of a doctor. Go premarital counseling, we call it. Yeah. That is the best way to do. Premarital counseling doesn't mean that you are marrying, that is why you want to do counseling. But otherwise, as a boyfriend and girlfriend, you can go and seek a help of a qualified doctor. Just talk openly and have frank discussion, rather than telling somebody that no, you are not good in sex because you ejaculated very fast first time. This is going to happen.
Yeah. And so coming next, there are so many creams available in the market, to make the intimate parts a little fairer. Do you think they work?
Well, I personally don't think it is right thing. Okay. You are using lubricant, it is okay. Keep the part clean. Don't use any chemicals unnecessarily. I think these are not even scientifically proved chemicals. So I would not advise somebody to just use any cream.
Even vaginal wash creams?
Now, medically speaking, as a gynecologist and a doctor, I mean, it has been recommended, don't use chemicals to clean your vagina. God is very smart. God has given everything perfect. You get vaginal discharge, and the part comes out, dirty. You need sometimes, there are so many bacteria are very important in vagina. Vagina contains more bacteria, So this is biologically important part. So by washing with chemical, you are even killing the bacteria which are required. So by washing vagina with chemicals, in fact, you are harming your body more.
And so as a doctor, you must be coming across so many patients on a day-to-day basis. If you can share any of the anecdotes, funny, bizarre, serious, emotional, whatever, any incident of, how much unawareness or how much ignorance is still there in the society regarding sex.
Okay, so this is very interesting question. I mean, I have many patients, but I'll give you one example. So last month, I received one patient from Rajasthan. She was referred by one of my patients. Now, marriage life, 5 years, no issue. So they went to see so many gynecologists. Doctor examined everything from top to bottom, male partner, female partner, everything was normal. So doctor will say, now everything seems normal, you better go for IVF. But they were not ready to go for IVF because they thought that everything is normal, why we are not getting pregnant. So they came to see me. When I examined and saw all the reports, seen by 5-6 doctors. Yeah. So then I started talking more and discuss about sexual intercourse, what's going on in your bedroom. And then I have shown them one small clip of penile vaginal intercourse, how other people are doing and how you are doing. So they explained to me, but they could not understand really. So when I was showing, the male partner was, moving up and down, up and down. So the lady told me, doctor, my husband, we do good foreplay, and then husband is inserting penis inside the vagina. He is not doing any movement. I don't know he has ever ejaculated inside or not. And I never knew about these things. I thought, and he thought that everything is fine. And after 1 or 2 minutes, he will come out. He will lose the erection because he's not moving. Then he will come out. And that's what. I said, okay. So I told them that this is how the real sex you need to do. After 2 months, I told them, now go home, have sex alternate day. So alternate day sex, I advise, and now I'm coming to the point. There are, most of the gynecologists will say, okay, do sex from 11th day to 18th day or 12th day to 16th day during ovulation time. Now, that doesn't mean they are wrong, they are right. But this is what my opinion is. Don't take it bad way. I receive many patients, he will say, male partner, doctor, I get good erection and happy sex life. But when my wife tells me that today you have to come home early, today you must do sex because it's my ovulation time, I cannot perform because of the pressure. That is called sexual performance anxiety. Now that leads to a lot of issues. I would advise simply to all the ladies, when you are not on your period, if it works out okay, please do not worry about your, doctor will tell you fertility and everything, it is fine. Continue treatment, whatever doctor has advised you, fine. Make love alternate day. So whenever you get ovulation, there is no pressure to him and the sperm is ready. Because when you make love alternate day, usually sperm survives in the body for 72 hours and normally ovum will survive in female body for 36 to 48 hours. So it is very easy to conceive without stress. I think stress is one of the major cause of not conceiving. Now this is my personal opinion. I might be wrong.
But
God knows.
True. And so a lot of youngsters watch a lot of porn. And how do you think it impacts their, real life equation with their partner? Okay,
so this is little controversial subject. Whether pornography is harmful or not, that is the question. Now, according to my opinion, first of all, pornography is helpful to learn whatever mistakes other couple made. Yeah. Just now I talked. Yeah. So, in a way, pornography is a good way to learn sex life. So, that is one. Now, watching pornography morning, afternoon, evening, and keep on doing masturbation is wrong according to me. Why? Because what happens that you are watching pornography to get sexual stimulation. You need a stimulation so that your hypothalamus brain center releases dopamine, serotonin, and other chemicals. Now, you keep on watching pornography, you need hardcore pornography to get more stimulation because your brain is now comfortable with normal pornography. You know what I mean, normal, soft pornography. So now you need more and more pornography, hardcore we call it.
Addict.
And then you become addicted to it. So what happens that suppose you keep on watching pornography for 1 year, morning, evening. Now when you get a wife, these girls or these women, they are normal, simple girls. They are not like a porn girl. I have seen pornography live, what happened during my education in USA. So those girls are, different kind. They have big breast, they remove underwear and bra like this and throw. They are young white girls. Or I'm just telling you, kind of, So those are different girls. But your wife is not like porn girl. And you need a hardcore pornography. She is not going to act like a porn girl. So you will get kind of disappointment or you will not get sexual stimulation. So sometimes, this is my opinion, pornography is okay up to certain limit. Anything in excessive is not good, my friend. Yeah. Okay.
And so what about prostitution? Do you think that the society should have prostitution?
Well, so prostitution has been there since years and years. If you read our history, 5 years ago.
The oldest profession.
This is oldest profession. There is no place in this world without a prostitution. Now, this is my personal opinion. Don't take it negative way. Take it positive way if you can. Otherwise, leave it. According to me, prostitution, we should be thankful to them because they are sex workers. They are providing service to needy people. Now, just imagine a male of 35 years old is not married and he has a sexual desire. So, do you think that if he rapes somebody is good, or he will go to a female worker, pay the money, have consensual sex? Consensual sex has been given okay by the High Court also. So, according to me, that is normal rather than defining them and labeling them as a bad way. I respect all the prostitution in this world because they are providing health, service to the society so that a male partner will not rape 60 years old woman or 10 years old girl. What is wrong? If you think in real terms, I think they are providing good service. So I think that is what it is.
And sir, one of the last questions, do you think it is fine to be asexual, like a girl or a boy, just saying that I don't feel like having sex at all?
So I believe in freedom of choice. If you think that you don't need sex, then it is fine. What is wrong? Yeah. Now the problem comes when you are married. So we'll talk in a different way. There are so many male or so many female, more female side, they are asexual. Why they are asexual, nobody knows. But that is how they have been born. Wired. Yeah, they have been wired. See, so many things we don't know, like so many people are homosexual. Why they are homosexual? Yeah, we don't know, but that is how they are. So let them enjoy life the way they want. Let homosexual enjoy the way they want. Let lesbian girl enjoy the way they want. At the same time, let heterosexual couple enjoy the way they want. At the same time, let a asexual female enjoy life the way she wants. And let male also enjoy. But there are less male than female. But I think it is okay.
It's okay. And so any concluding remarks, that you would want to...
Well, I would advise you to have a happy and healthy sex life with your partner. Safe sex with your partner. Enjoy life with your partner. Be sex positive with your partner. And please do not afraid to seek help of a professional person if he or she needs help. I mean, we are talking to female audience, so there are so many issues female have. There is no female Viagra, but most of the time they do not need Viagra. It is more, female sexual problems are more related with mind rather than body. So have your mind open, have open communication with your partner, and enjoy your sex life.
Thank you so much, sir, for your insights and for your time. And for more such interviews and interactions, keep watching Women's Social Corner. Thank you.